We would talk a little bit about the ACA and where we've been as a part of health reform and the benefits that we think that will accrue to Massachusetts under the ACA, and then have an opportunity for everyone here to ask questions and raise some any issues that you have. Or one of the things that we found has been very valuable is by having these communications, we've really been able to talk about and address a number of the issues that individuals and businesses across the Commonwealth have had with the ACA to try to address some of the concerns. So I'll jump in and then I'll ask Secretary Shor to help out. Obviously this has been a long journey since we did Chapter 58, and we began the process around creating healthcare coverage for the population of the Commonwealth. We started at that point with a shared partnership model with not only the state, but the businesses, the providers, and the advocates all come together under the umbrella of a strong population is a healthy and covered population. So using that shared responsibility model, we created Chapter 58, which we now know has covered 97% of the adults in Massachusetts and nearly 100% of the children. We know that by creating the healthcare coverage that we did under Chapter 58, that nearly 90% of adults have a primary care physician, and 4 in 5 of those individuals have actually seen a primary care physician in the last year. We know our emergency room visits are down, which is good because a lot of primary care was happening in our emergency departments, which is really the worst place for primary care to happen. There's no continuity and it's a high cost setting. And we know that under the Affordable Care Act, expanding on what we did in Chapter 58, access to preventative services are up, and access to screening mammograms, immunizations, and other things are up for the population of Massachusetts, which is really helping us transform our systems from into a system really focused on prevention and wellness, which we think will have a long-term impact on not only the care that's being provided, but the cost of that care. And I'll talk a little bit about the cost of that care because 2 years ago, the governor signed legislation called Chapter 224 that was around cost containment that created a number of new mechanisms for us to address what has become a real issue here in Massachusetts, that being the cost of the care. The quality of care has never been questioned, but we do provide some of the most expensive care in the United States. And we realize that has a real impact on not only individuals, but it also has a real impact on businesses large and small. So under Chapter 224, there was initiatives to address the overall cost of care, the provision of care, how people were going to partner together, the creation of the Health Policy Commission to address many issues in health. We are required to put a health planning council together to put a state plan on how we will provide healthcare services in the state. And we think that the progress that we've been able to make to start to bend the cost curve down and use those resources in a wiser way helps support this journey that we've been in health reform. Beyond that, I think for many of the businesses, both small and large, there's been a number of benefits to what we've been able to accomplish with health reform. And maybe Secretary Shor, you could talk a little bit about that and put some finer points on some of the issues we've already talked about.
Sure. We are very proud in Massachusetts of the fact that we have nation-leading levels of health insurance coverage with over 97% of our residents insured, and we are obviously very deeply committed to ensuring that all residents have access to the health care that they need. While we are extremely proud of our success in achieving nation-leading levels of coverage, the ACA gives us some tools that we could potentially do even better. There are some low-wage workers today, very low-wage workers, who hardworking people, work in jobs where their employer actually offers them health insurance, but because their wages are so low, they can't afford it. The ACA creates an opportunity for them to get affordable coverage through Mass Health. That's a big step forward, particularly as we know that many of our remaining uninsured in Massachusetts are very low-income people. Notwithstanding the fact that we have among the most generous health insurance safety nets in the country, if not the most generous. We have people today who are just over 3 times the federal poverty level. They don't qualify largely for state subsidized health insurance today because the cutoff for the Commonwealth Care Program is at 3 times the poverty level. These may be people who are buying health insurance on their own. They may be paying a lot for it if they don't have coverage through their jobs. They may be buying it on their own and paying a lot for it, in particular if they're older but not yet eligible for Medicare. The ACA opens up federal subsidies to help make coverage for people between 3 and 4 times the poverty level more affordable. And frankly, there may be some people in the ranks of our currently uninsured that fit that category and can potentially become newly insured as a result of the Affordable Care Act. Those are great steps forward, and they are complemented by other provisions of the ACA that make it easier than it's ever been before in Massachusetts to get insured and stay insured, whether it's new tax credits that small businesses can get for insuring their employees, whether it's the fact that young people can stay on their parents' health insurance policies up to age 26, whether it's the fact that the ACA closes the Medicare donut hole, making prescription drug coverage more affordable for our seniors. About 60,000 seniors today are getting about $667, I think, in savings on prescription drugs because of the progress already made in closing the donut hole, and they'll get more savings as it is completely closed. So that's great steps forward for a state that's already done great things with health insurance coverage. The ACA doesn't only make coverage more affordable, but it makes it easier to access coverage. We know that notwithstanding the fact that we have among the most generous health insurance safety nets in the country, it can be difficult for people to navigate. We have our state subsidized health insurance programs spread over 4 organizations. And within one organization, Mass Health, it's distributed among a number of different programs. The ACA gives us the opportunity, number one, to streamline our state health insurance programs. Health insurance will now be offered, subsidized health insurance will be offered between the connector and Mass Health. So we're reducing the number of organizations providing coverage. Within Mass Health, we're streamlining the coverage categories. And most importantly, the ACA has given us the resources to create no wrong door, one-stop shopping for health insurance for starters. It gives us the opportunity to take what is a lengthy paper-based process for qualifying for state subsidized health insurance, where people can wait for 45 plus days to find out first if they're eligible and only then begin to have to choose a plan, and shrink that to something over the coming weeks to something that's near instantaneous, assuming they're qualified. That's great. And this is going to be an opportunity for the Commonwealth of Massachusetts to take subsequent steps to make one-stop shopping for health insurance also a portal for one-stop eligibility determination for other state programs for which qualified people can sign up for, including supplemental nutrition assistance and temporary assistance to needy families. So this is a great way to make it easier to access the coverage that people need. The ACA does a lot of good things to protect consumers and streamline, to protect consumers and promote competition, and that's even outside state subsidized health insurance. Since 2010, the Affordable Care Act has made it possible for people to go see their doctor for an annual visit without paying a copay. It's a real difference for people. It encourages good health. It encourages forming a relationship with a primary care doctor. And it ultimately will save money for people, if they're finding out, if they're getting regular checkups and finding health problems earlier rather than later. It makes it easier for people and small businesses to shop for health insurance. Our health connector, Gene is the executive director, has led the way by organizing coverage into metallic tiers. You know, you have gold coverage, which is coverage for which you'll pay a higher premium, but you won't have copays and you won't have coinsurance and you won't have deductibles. That ranges all the way down to bronze coverage, where you have lower premiums, but you'll pay higher deductibles, you'll pay higher copays, you'll pay coinsurance. People have different preferences, people have different needs, and because the connector has organized coverage this way, it's easy for people to understand what they're getting, and it's easier for people to compare the options offered by different health insurance carriers. The ACA takes this model that has just lived within the connector and expands it to the entire market for small employers and individuals who buy coverage on their own. So if you're in that market, whether or not you choose to buy coverage through the health connector, and we encourage you to buy coverage through the health connector, you know, you have a new tool to compare health insurance options on an apples-to-apples basis. You have a new tool to understand what you're getting when you buy health insurance. You have a new tool to match your needs to how you shop for health insurance, and that's a great thing. Within the connector, I'll turn the mic quickly over to Jean. The ACA really makes the connector, I believe, a destination point for empowered shopping for health insurance for individuals and small businesses, including preserving many of the great things that we see today in terms of coverage available through the connector. So, Jean, do you want to talk about that for a couple of seconds?
Yeah, sure. Thank you, Secretary. So, as Secretary Shor mentioned, we played an important role in really pushing Massachusetts to the health reform success it has achieved to date, and we will continue to pursue new opportunities. And there are indeed some very exciting new opportunities brought by the ACA. But for those of you who may not be extremely familiar with who we are an online marketplace. We have a website. It's www.mahealthconnector.org, where people can come in and go through a simple, easy to navigate process and compare health plans that are actually making sense to you. So our goal is to provide a shopping experience that can make it easy, and then for average consumers to identify the health plan that best serves their needs. So we currently serve about 250,000 members. That actually is the majority of the people that was brought into the coverage system as a result of the Massachusetts health reform. So we serve a majority of those people today. And some of these are small businesses, some of these are individuals. The vast majority of them are individuals, including about 200,000 subsidized individuals under our Commonwealth Care Program. We are privileged to continue to serve this population going forward, particularly because of the new opportunities that are brought by the ACA. As Secretary Shor alluded to, there will be more people who can access subsidies through the Health Connector as a result of the ACA due to the expansion of the subsidy structure. We are introducing a new suite of products, so we will have new medical carrier, and we have new products, and we're also adding dental coverage for the first time. So you may not know that even though Massachusetts has 97% of the people covered under health insurance, only 3/4 of the people actually have dental insurance. So there are a lot of people who do not have dental insurance, including many children. And then the reason why it has been difficult for people to access dental insurance is to a large extent attributed to the fact that there is not an easy to access dental insurance market for people who purchase this type of policies on their own. And then the Health Connector is going to, for the very first time, offer a product suite, and also just like what we have done, I would say successfully with medical insurance, an easy to access platform where people can actually come in and go through